I need to make sure. Okay. And I take it, Jean, I'm waiting on Ashley to start, to let me know.
Hey, Yvonne, is Janine. We're live now. You can go, you can start whenever you're ready.
Does both of my phones start ringing at the same time? Apologize for that. We're gonna hang those, stop those. Oh, okay. They just messed up my. All right. All committee members are present. I don't see Chantel.
Well, Chantel is here.
All right.
On a cap because I started washing my hair and got interrupted several times this morning. So,
All right. I'd like to call to order the Health and Human Services and Aging Committee today for Wednesday, June 17th, 2020. Currently, the time is 1:04 p.m. Madam Clerk, can we have a roll call, please?
Calling the roll, Ms. Conwell,
Present.
Mr. Jones. Mr. Jones is absent at the moment. Ms. Brown,
I'm here.
Mr. Miller,
Here.
Ms. Stevens.
Present.
We have a quorum.
All right. Madam Clerk, has anyone signed in for public comment? I don't remember seeing an email.
No, Madam Chair, no one submitted any public comment.
Okay, thank you. Approval of the minutes for the June 3rd, 2020 meeting. I'd like to make a motion to move those forward. Is there a second?
Second.
Okay, they were been moved and seconded by Brown. All in favor, say aye.
Aye.
All right, there's only one item before us today. It is Resolution 2020-0118. Madam Clerk, if you could read that into the record, please.
Resolution number 2020-0118, authorizing an amendment to a master contract, which includes number CE 1800183-01 through CE 1800186-01, various providers for emergency assistance services for the period May 1st, 2018 to April 30th, 2020, to extend the time period to April 30th, 2021, and for additional funds in the amount not to exceed $825,000.
Thank you. Madam Clerk, who is here to speak to this today?
Good afternoon, it's Christine Alexander, Health and Human Services. On behalf of the Division of Children and Family Services, we are requesting approval of a contract amendment with multiple vendors for emergency assistance. Emergency assistance includes food, furniture, and basic appliances for children and families that are at risk of becoming involved with children with DCFS. This amendment will extend the contract period through April 30th, 2021. With me today is Lisa Paterka, Senior Manager at DCFS, if you have any questions that need assistance answered. Emergency assistance is provided so that families may be diverted from involvement with Children and Family Services or so that caregivers can better meet the needs of children in their care. Families and caretakers approved for emergency assistance are often experiencing a crisis and therefore need items such as beds, cribs, food, and basic appliances. These items are provided as soon as possible following the receipt of a purchase order or a gift card from Cuyahoga County. The food is provided in the form of a gift card in increments of $25, which the county purchases on a monthly basis. The current average cost per month this past contract year was about $5,600. The gift cards provide basic food items including fresh meat, dairy, bread and produce, and special food items for infants, toddlers, and those with dietary restrictions and or allergies. Furniture is provided in the form of a pre-approved purchase order in accordance with established product price list. This price list has remained the same since 2018. The average cost per month for furniture and basic appliances is about $47,000. Purchase orders include specific basic household furnishings, including bedroom furnishings from infant to adult, basic dining and living room furniture, as well as kitchen and laundry appliances. Utilization of emergency food and furniture has increased only slightly from the same period last year. While both the grocery and furniture stores have remained open during the pandemic, spending has been a little bit lower during March and April due to workers working remotely and a fewer number of intake referrals to the hotline. DCFS families are still able to purchase food and furniture and appliances. Generally, the families do not come in to select furnishings. They are ordered over the phone, and the available vendors will deliver those services and set them up as well. According to DCFS, clients rarely come into the store, and basically their needs are met through the social worker's request for the purchase order. We did procure this contract, this master contract, through a formal RFP in 2018. This amendment represents the second of 2 option years to the original contract. The amendment would extend the term through April 30th, 2021, at which time it's the intent of DCFS to issue a new procurement for these goods. If DCFS is unable to provide these services, they risk more kids coming into custody, delayed family reunification, and fewer kinship care options. This in turn means greater utilization of costly out-of-home care. DCFS relies heavily on emergency services to support the placement of children with their relatives or kin, and they usually have just enough to meet their own needs. The original vendor list during this bid was, we had 38 vendors. We had 5 proposals that were received, 4 that were approved through this master contract. Are there any questions?
Yes, Ms. Alexander. Am I getting an echo? Can everyone hear me okay?
We're given a little bit of an.
Yeah, it's like, why is it my turn? It's usually Nan's turn. Not my turn.
Good now. You sound good now.
All right. If any items, Miss Alexander, are damaged, are they under warranty? I don't think we've ever asked that question. If since the clients don't come in and they're just delivered and set up, how does that work? I guess that would be in terms of the furniture.
Yeah, that's actually a great question. I have not heard any reports of the damage. They obviously, they are under contract, and my assumption would be that they would be replaced, but I can certainly look into that for you.
Okay, thank you. And so this is not commingled with any PRC, these vendors, do they assist us in any of the PRC funding or anything like that?
This is separate funding. The contract is 79% federal emergency services dollars, 21% health and human services levy dollars. In general, families that receive PRC are not eligible for both under the same conditions with emergency furniture.
Okay. And did this contract in any way increase? You may have mentioned that, but did it increase in any way from the last?
There was about a 2% increase from this time last year.
Okay, I will open it up to my colleagues. Are there any other questions in regards to this contract?
Madam Chair.
Councilman Miller.
Yes, just one question. In your presentation, you were talking about how the participants rarely go to the stores themselves, but it's normally handled with the help of the social workers and done over the phone.
Correct.
My question is whether what you just said there relates to how we were operating during the COVID-19 environment, or was it done this way even before COVID-19 got underway?
This is usually done that way, regardless of the COVID crisis. Again, there was a slight downturn in utilization during the COVID, but that was primarily due to fewer intake referrals to the hotline at DCFS.
Thanks, Madam.
And Christine, I want to follow up a little bit about something else that you stated. The $40,000 you stated, I guess, for the furniture. This is not a rental. This is rental agreements that we're paying or anything for ongoing furniture. This is straight.
No, that's a great question. They own the furniture. The $47,000 is the average monthly utilization over the past year.
Okay. Any of my other colleagues have any questions?
Madam Chair,
Councilwoman Brown?
Madam Chairwoman. So the one question I have is with regards to the vendors and the selection process. If we choose them, do they submit? And you may have said that, so I apologize because you gave us a lot. So I appreciate all the information.
Sorry.
No, it's good. But in this world of, technology and phones ringing here and things coming there, I may have missed it. So I just wanted to know how we identify the vendors.
Okay, so again, we had 38 vendors on our original vendor list when we issued the RFP. That was a combination of both furniture stores and grocery stores. We received 5 proposals back and we awarded 4 contracts. The 5th proposal, I believe it was TJ Maxx actually, was unable to produce or use our purchase orders. DCFS has issued purchase orders for purchases for furnishing. So they didn't want to pursue it any further. So we did award to the 4 remaining respondents.
Okay, so five responded, 1 dropped out, and then how do they go about finding this solicitation? Do we send it out to the masses, or is it something they look for? Because I know we've used some of these vendors in the past, so just curious about that selection process.
Sure, I could definitely send you that vendor list. We pretty much look up furniture, clothing store, this isn't for clothing store, our emergency clothing is a separate contract, but furniture and appliance stores, the Targets, the Silvermans, TJ Maxx companies, certainly as it relates to the Acme Fresh Market, Aldi, and the food stores that are in this area. The nice thing about the furniture stores are we have an east side store and then 2 west side stores, so it's easily accessible to our clients.
And the grocery store too. I'm a fan of Dave's. I know that they have a lot of locations within the inner city as well, so, or multiple locations in some of our hardest hit communities. So just I appreciate that. Thank you.
Sure.
Ms. Alexander, can you send the committee a list of the items that they're able to purchase? And I guess I'm not too much interested in what Dave's sends, but probably the furniture and just so we can see the quality of the items that are being purchased.
Sure, and that includes a price list and then charges for delivery and setup. So I can send that today.
Okay, thank you. Any other questions from my colleagues? All right. Anything else that you would like to share, Ms. Alexander?
I think that's it for now. Thank you.
Okay, I see that we're behind in this contract, so I already know that we need a second reading suspension due to the contract has been expired already. And when are you doing the RFP again?
So the RFP will probably issue in November for a May 1 start. So sometime at the end of the year. We try to do it before the holidays.
And hopefully we'll be back in the office. I know we had set up a meeting just to let my colleagues know prior to COVID-19. Me and Christine was going to sit down and go and Levine, and we're going to go over all of the contracts before the RFP, so we could look at some of those questions that you've identified, Councilwoman Brown, about looking at the different vendors and all that. But COVID happened, so it kind of stopped that. But I want to keep that on me and Christine. I think you've already have your presentation ready, right?
Yes, and I do want to add, and I feel particularly bad for the vendors. In this particular instance, because the stores themselves are physically closed, and these aren't really large vendors, the West 25th Street Furnishings, these are smaller vendors. It was really hard for them to get the required documents that we need. So while we can award a contract, we can recommend an amendment, there are a variety of documents that aren't easily obtainable. So a non-competitive award letter needs to be notarized, banks were closed. It was really a challenge for them. So, and they stuck with us, and I appreciate the reading suspension request.
Okay. Yeah, we just want to look over things like the other vendors, go over issues of why they can't be accepted. We want to spread the wealth, so to speak.
Oh,
And
yeah.
so we will definitely get back to that. And I'm particularly interested in seeing the list so I can pop into some of these stores. And I've been to AZ Furniture, but I've never matched the list to see, I see the type of quality of furniture that they have. And I'm not going to say I'm picky or anything. I just don't think I would purchase anything from AZ Furniture. So I just want to make sure that things that we're purchasing, for places with kids are going to last. You get me. So no other further questions or additions to this. I would like to move this to the full council under second reading suspension. Is there a second?
Second.
Okay, it was moved and seconded by Purnell and probably Miller. So all in favor, please say aye and unmute your line.
Aye.
All right, thank you very much.
Thank you.
All right, thank you, Miss Alexander. We'll get on each other's radar soon. Madam Clerk, is there any miscellaneous business?
No, Madam Chair.
Okay, any of my colleagues have anything to share?
Madam Chair,
Councilman Miller.
I have an item for Miss Alexander, if she could come back for a moment.
Okay.
Yeah.
My question, Madam Chair, to Miss Alexander is whether there are aspects of response to COVID-19 that are being handled by or where the HHS department is heavily involved in, or is it all being done out of the county health department?
We've purchased emergency services through a contract with Franklin County for a DCFS child that tested positive in residential care. And we had to move that child to a residential placement that would accept a COVID positive. That's the only emergency purchase I'm aware of. I know the Office of Homeless Services does have some COVID positive hotel beds that they're using for some of our homeless clients that are being discharged from the hospital that are COVID positive. Beyond that, I'm not really aware of other contracts in HHS.
Okay, so besides those things, are there any areas where HHS has programmatic responsibility to provide services?
You got to raise your hand somehow. Do you want me to go over there and hold on? Sorry, have you finished? Okay.
David on the phone.
Oh, all right.
Through the chair, this is Michelle Pomerantz, Director of Regional Collaboration. HHS Director Dave Merriman is trying to zoom in and he's on a call. He just called me and he wanted to make sure that he was able to respond to this question. Jean, is there anything can you guys see Dave on the call?
I don't see him at this time yet.
Dave, do you want to log in? Do you want to log in, Dave, to the Zoom?
Michelle, I can text him the link from his phone if he wants to do it from his phone.
Yes. I think so. Yes, Trevor's gonna text you the link.
Thanks.
Okay, and
I'll do
I'll
that.
hang up instantly. Yep. Thanks, Trevor. Dave was gonna try to be here, but he had another meeting that he had to go to, so he'll jump on and be able to respond to your question, Councilman.
Thank you.
All right, David, we see you? Yeah.
Hi, again, David Merriman, Department of Health and Human Services. My apologies for not being able to join the committee from the headquarters. I understand there was a question from Councilman Miller about the role of the Health Department and how we're working together. If I can ask Councilman Miller, if you could please repeat the question.
Yes, thank you very much, Director, for jumping on the meeting for the committee. And my question is that we know that most of the county's COVID-19 response is being coordinated out of the health department. But my question is whether there are some aspects where the Health and Human Services Department either has primary responsibility or has partnership responsibility to help provide COVID-related services.
Well, thank you very much for the question. I would just recognize, I feel there's a very strong partnership between the health departments, both, and the County Department of Health and Human Services. Until this week, we were meeting on a weekly basis. We would have a call every Thursday morning. We invited both as well as Cleveland Department of Health to that call. All of our Health and Human Service directors were on and we were talking various components of coordination of services. And so each department that had a specific service area that related to COVID would report out on what they were doing. And then we would gather feedback from both the county and the city health departments. So I think it is probably a little more complicated to say that we have a primary responsibility or secondary responsibility. I think it's a partnership, and we work extremely closely with Meryl Gordon, the director of the Cleveland Department of Public Health, as well as Terry Allen and Dr. Heidi Gillette. And that partnership includes everything from COVID testing. We include discussion of distribution of PPE or personal protective equipment. And increasingly, we're talking about ways to support each other with prevention. One other example, when discussion pivoted to not just the social service system, but the behavioral health system, our relationships with the Adams Board were tapped, and we facilitated integration of the Adams Board into that discussion as well. So I think we have a daily cadence to our interaction with the health departments, addressing specific issues as well as the broader operation of our response to COVID.
And Madam Chair, Director, what are the primary prevention strategies that you're pursuing at this time?
I think the first and the most significant is the distribution of PPE. I think there's a lot of documentation on this, but I think we celebrate the fact that over 1 million items and over 1,000 essentially disbursements of PPE have been made by the Emergency Operations Center. And I think providing that equipment to the community, providing it to our partners, everyone from homeless service providers, early childhood centers, after school programs, nonprofits. We've done really extensive distribution of those resources. That's the most significant. I think what we're now talking about as we prepare to have buildings opened, we are also, looking at if we develop signage that could be used by a partner, how do we provide that signage? How do we share that? How do we share our lessons learned? So that's sort of the stage that we're at right now. And then you do veer into the intersection between prevention and testing. And so we've been giving feedback to the health departments as well as Metro on what are the centers that we work with where there's congregate living and how can we support them to access those centers to do increased testing.
And Madam Chair, Director, it sounded like you were saying that until this week you had been meeting weekly. Have we decided that enough progress has been made that we no longer need to meet weekly?
Yeah, we will meet this week and then we will take a week off and then we'll move to a meeting every other week. And I think everyone felt like the progress we had made and the openness of the communication, the documentation of issues, and the use of Microsoft Teams to post notes, to post, answers to questions. And so everyone can learn from each other is probably a reasonable strategy given how things are going right now. We'll revisit the schedule as things change.
And Madam Chair, to the Director, final question. What's your current assessment as to whether COVID-19 in Cuyahoga County, is it increase? Is it remaining steady? Is it going down slightly? Is it going down rapidly? Where do you think we are?
Councilman, I don't think I can answer that question. I gather information from the state. We still get daily updates from Michelle Pomerantz. She shares the information that's been shared by the state. We're also working, as I said, very, very closely with Dr. Heidi Gillette and Merle Gordon. And I think what we track are the overall status of our response, where testing is occurring, where testing is needed. And I don't think I could speak to the epidemiological profile.
Okay, thanks, Madam Chair.
Okay, anything else from anyone else? All right. I want to thank everyone for your time and attention to this committee and moving forward the needed contract today. And this meeting is adjourned.